Hi, my name is Olivia, and I did my project on the effects of Botox injections for patients with spasmodic dysphonia. So the first couple of slides is just an overview of what spasmodic dysphonia is and like the types that there are. So first slide is what is spasmodic dysphonia. Spasmodic dysphonia is a voice disorder in which there are involuntary movements, spasms of the muscle in the larynx, which is also known as the voice box, and it affects the flow of speech along with the voice quality. So with spasmodic dysphonia, it's also known as laryngeal dystonia. So the picture I have below, with normal speech, the vocal cord is open, and then with the other picture with irregular speech, there's like involuntary spasms of the vocal cords. So in the next slide, the types of spasmodic dysphonia. So the first one is adductor spasmodic dysphonia. So that's when there's irregular spasms that cause the vocal cords to stiffen and close shut, and this affects the vibration of the vocal cords as well as producing sounds. And usually with adductor spasmodic dysphonia, it causes the quality of the voice to be more strained. So the next one is adductor spasmodic dysphonia. So that's when there are irregular spasms that cause the vocal cords to open, which is letting air escape during speech. And with that, it affects the vibration of the vocal folds as well as the ability to produce sounds. So it makes the quality of the voice more breathy. And the last one is mixed spasmodic dysphonia, which is a combination of both adductor spasmodic dysphonia and abductor spasmodic dysphonia. So like with mixed, it has symptoms of both of the other dysphonias. So in the next slide, we're just going to be talking about the causes and signs of spasmodic dysphonia. So with the causes, are dystonia. So dystonia is a brain disorder that causes the muscles to tighten, and also muscle tumors in the body with the nervous system, and stress is also another cause. And lastly, also when one is speaking, the vocal folds are not moving the way it should be. And some signs that you'll notice for spasmodic dysphonia is voice trouble that occurs once in a while. So like problems in the voice will worsen over time. Stress and tiredness can contribute to that as well. And sometimes the voice problems go away when you are signing or laughing. So the voice spasms can come and go during the day. And also signs of spasmodic dysphonia starts between the ages of 30 and 50, and they are more common with women. So we're also going to look into the testing and treatments for spasmodic dysphonia. So with testing, the professionals on the team that are most likely to test patients with this type of disorder are a neurologist. So with a neurologist, they look into the signs of problems with the brain that can lead to spasmodic dysphonia, and also an ENT doctor. So they look into the vocal folds and see how the vocal folds are moving. And lastly, a speech language pathologist will test how you are using your voice, as well as how the voice sounds. So with the treatment, you can speak with a psychologist. So with a psychologist, they will assist the patient to learn how to live with spasmodic dysphonia. And another way is to work with a counselor with like career path. So with that, if you're experiencing trouble with your voice when you're like at your job, another way is also injecting Botox. So like Botox injections into one or both vocal folds. And lastly, doing voice therapy sessions with a speech language pathologist to help produce a better voice. So now we're going to get into Botox injections and how they're utilized for patients with spasmodic dysphonia. So with that, patients with spasmodic dysphonia, Botox injections are utilized to weaken the muscles of the vocal cords. So in this way, they no longer have involuntary spasms, allowing their voice to sound more natural. So with Botox, they're injected into the vocal cords through a small needle that goes through the skin of the neck. So with patients that cannot get injected in that way, they have to go under anesthesia, and then they're going to be injected, their vocal cords are going to be injected with a long needle down their throat. And the use of dosage for injecting vocal cords is 1 to 2 units. Sometimes it could be as high as 15 units. So the doses are much smaller than what is given with cosmetics. So like with cosmetics, like with reducing wrinkles. So in the picture that I have over to the left, it shows a patient that's getting like Botox injection, but he's getting it done with like the smaller needle. So going on to the next slide, so the phases that occur after the Botox injections take effect. So Botox injections take about 24 to 72 hours to begin taking effect. So there are 3 phases that happen after the fact of Botox injections take place. So phase number 1 is breathy phase. So that's when the Botox is at its highest concentration, in which the vocal cords are maximally weakened. So the patient's voice may sound breathy, soft, or high pitched. So this phase, it can last for up to several days or weeks, depending on the dose of Botox that the patient had received. The next phase would be normal phase. So the vocal cords are stronger, but not as strong. So the patient might go back to having spasms, but the voice or breathing is quite normal. So with this phase, it can last for weeks to months. And the last one is recurrence phase. So with that phase, the spasms begin again. So since the Botox is like reabsorbing, so the patient may start to notice that their voice or breathing is starting to worsen again. So consideration would be to receive another Botox injection. So an important fact to know is that sometimes the Botox doesn't go in, or like doesn't go into the same spot as the previous injection. So the Botox was missed. So patients who are having difficulty with that type of injection is because of their anatomy. So with Botox injections, some things that are important to focus on, especially with like injections for patients with spasmodic dysphonia, is the dose and timing of the Botox injection. So for that, the goal of dose and timing is finding the right dose and timing for their needs, and it also takes time. So every patient is different, so it means the amount of Botox that a person takes will be different. And also there are some patients that may need injections for both cords, while some other patients may need like a higher dose of Botox. So with that, the higher the dose of Botox is, the greater the side effects are. And also another thing to keep in mind is maintaining a log. So the goal of like maintaining a log would be finding the dose that gives the patient the longest relief of symptoms with the least side effects. So with that, just making sure to keep track of the Botox injection. So like what dose was given, how long the voice was strong for, and also putting into consideration like how long the side effects lasted. So here I have a video. So the video was called Botox injection for spasmodic dysphonia. So in the clip, for up from 48 seconds up until 2 minutes and 21 seconds was the first patient. So the first patient had adductor spasmodic dysphonia, and she was receiving Botox injections to the vocal cords to assist with making her voice sound more normal. So they go through her procedure and like doing the injection. And with the second patient in the same video, in parts 2 minutes and 35 seconds till 2 minutes and 56 seconds, she was also receiving Botox injections to the vocal cords. But with her video, it shows like the side where she's getting the injection done, and on the other side it showed the inside of her throat. So it showed like the needle, and then showing like how the vocal folds were kind of like moving in and out a bit. And so I did find a case study. So in the article, acoustic variations in reading produced by speakers with spasmodic dysphonia pre Botox injection and within early stages of post Botox injection. There's a case study that was done, and the participants were 31 patients with adductor spasmodic dysphonia, and the age range was from 22 to 74, and there were 26 women and 5 men. So all the participants, they were new recipients of Botox, so they never received Botox before. And the examination of their voice had occurred before and after Botox injection. So they were doing testing for them like before they received Botox injection and after. And so they focused on variables such as like bonatory breaks and frequency shifts. So the participants had to read samples of the rainbow passage to identify any abnormal bonatory variables. So the result after doing research from the article was that most patients were able to reduce more utterances with as well as connected speech following a post Botox injection. So basically, when they got the injection, they noticed that their speech was more better. They were able to produce more sounds as compared to before they had the injection. And my last slide is the references, and that's it. Thank you.